And I'm going to hand it over to Peter Josling, our formulator and friend.
Right. Okay. Well, thank you very much, Jessamine. I was just explaining to Kate, we haven't met for years and years, although we did meet a long, long time ago. Where was it, Kate? Do you remember?
We have only met on the phone. It was back when you were doing phone calls, when Jan was doing your products. Then she had you come to some events there in Michigan.
Yes, I remember. So you didn't make it to Michigan?
No, I didn't. I'm still on the left coast.
Okay, right. So tonight we're just going to talk a little bit about HeartLife for 5 or 10 minutes, and then we'll just open it up for a few questions. And I hope to be able to answer your questions, Kate, regarding this ablation. We'll see whether it can help you or not. So unfortunately, in the US, you still lose about 370,000 Americans per year to heart disease. And those are all under the age of 65. And you're probably also aware that for women, their rate of heart disease increases dramatically after the menopause. So there are lots of ways that you can contract heart disease. And they reckon that in the US, there are well over 100 million people that have just elevated blood pressure, for example. Now, if you look at the risk factors, an elevated blood pressure, an abnormal heart rhythm, high cholesterol, smoking, obesity, a lack of physical exercise, diabetes like me, I'm a type 1 diabetic, a very poor circulation, and believe it or not, one of the biggest problems now for heart disease, or at least producing heart disease, is stress. And of course, in the last 18 months to 2 years, we've all around the whole world been under intense stress with all this COVID-19 stuff flying around the world everywhere. And I've just read an article that suggests that this new variant from South Africa is extremely dangerous and is able to avoid both the immune system and any kind of response that your immune system might have made to vaccination or anything like that. So it is a very, very stressful time. And the heart is not an organ that deals very well with stress. It can cause quite a lot of problems in the brain and in the circulatory system. And quite naturally, as we get older, your circulation tends to suffer. So they reckon that about 75% of visits to the doctor these days are actually stress related. So it might be, a divorce, it might be a job, it might be COVID. It could be almost anything that causes that heart to be under stress. So we did a load of testing on the HeartLife some years ago to show that as soon as you take the product, you start to relieve stress on the heart very, very significantly and very, very quickly. And I think if I remember rightly, the figures were if you were sitting down, you would actually reduce your stress levels by 60% in less than 10 minutes. And if you were standing up, you can measure standing stress levels as well, then you would reduce that by more than 50% within 10 minutes. So the HeartLife is very good at relaxing arteries and allowing the circulatory system, i.e. the heart, to pump blood around the cardiovascular system much more efficiently. Now, as we age, these vessels in our necks and around our heart and all over the body begin to age faster than we do on the outside. So often our internal artery age is more than our actual biological age. And that's quite dangerous because it means you're basically getting worse on the inside much faster than you are on the outside. So it's really, really important to do something that can basically flex the arteries in your cardiovascular system. And that again is what HeartLife does. We'll learn about which agents do that specifically in HeartLife. But the idea there is if you can increase the flexibility of your arteries, particularly up here in the neck and in the heart, then your heart will actually pump the blood around the system a lot quicker and under less stress. And that will mean you'll get more circulation to the extremities. You'll feel more relaxed, and your arteries will not age as quickly. And in fact, we've shown that you can even reverse the aging of your arteries if you take HeartLife on a regular basis. So really, anybody over the age of the menopause needs to think about taking HeartLife, whether you've had a history of heart disease or not. But if you're like me, my father had a history of diabetes and heart problems, then my risk is even greater. So if you've got any heart disease in your family, or you already suffer from high blood pressure, high cholesterol, high stress levels, then you are the kind of individual who's going to do much, much better on HeartLife if you're on it for a regular basis, because it will reduce the aging of your arteries internally, and basically that will actually effectively make you live longer. And that's where this product really needs a little bit more promotion and understanding, because it is very good at increasing your lifespan. And I mean that quite seriously. Now, we haven't done any morbidity studies yet because they're very expensive to follow people. But clearly, if your arteries are younger, they'll go on longer until they stop working, or they get bunged up, or whatever the case may be. So what you need to do is to be confident that HeartLife can do this. So we started off doing a load of tests on heart rate, pulse height, arterial wall stiffness, artery age, heart stress levels, and abnormal heart beats and rhythms. So these also cause major problems in patients. Now, an abnormal heart rhythm is something that is normally controlled by a pharmaceutical drug, because if your heart is out of rhythm, then it makes it very difficult for it to beat properly, and that will basically increase the left side of your heart, and that can then lead to a heart attack or to a stroke, and can even lead to sudden death. So it's very important to try and look after the organ as much as you possibly can. And I think the only other thing I wanted to say was that if we look at the way arteries age, you can definitely reverse that with HeartLife. And I did mention, obviously, that the stress levels are significantly reduced. The other really cool thing about HeartLife, which is always worth telling you, whether you've heard it a million times or not, is that the quality of your circulating blood, the red blood cells, their quality is improved dramatically, very, very quickly. So literally within 10 minutes of taking a couple of capsules of HeartLife, I can look at your blood under dark field microscopy, and we can see that your red cells improve significantly. They're less stuck together, they're less misshapen, they're less roleoed, which means there's a whole big clump of them all over the bloodstream. And you can see that that changes literally within 10 minutes. And if you carry on with HeartLife at just 2 capsules a day, after 1 month, your red cells are almost completely normal. And more importantly, throughout the blood plasma, the cholesterol crystals have gone, the parasites have gone, you have more white cells. And remember, it's the white cells that are crucial for preventing attack from what? Heart disease, cholesterol, blood pressure, but also COVID-19. So this is helping your immune system deal with infectious organisms, and that could be anything from a cold or a cough right the way through to what we've just mentioned, the COVID stuff. So what is it that's in HeartLife? Well, we'll just read you out the contents. So obviously there's allicin powder in there. We wouldn't be having any products from Dr. Josling without stabilized allicin. The stabilized allicin is very good for reducing cholesterol and blood pressure. It's very good at boosting CD4 T cells. These are the killer cells that your immune system needs to be able to gobble up all the rubbish in your circulatory system. The allicin is also extremely good at taking these other agents around the blood supply. So we have flaxseed, we have sesame seed, we have arginine, and we have cayenne pepper. So all of those agents are known to be good for your cardiovascular system. They are all very good heart attack preventers. Why? Because they open up vessels and arteries. Like we said, with all the arteries as you age, they get stiffer. But when you take these compounds in combination with each other, you open up these arteries, you get a lot better blood supply to your periphery, your fingers, your toes, your gentleman bits, your lady bits, and all that kind of thing. And basically, you can do that with just 2 capsules a day. The maximum dose, in fact, with HeartLife is just 6 capsules a day. And I really do thoroughly recommend it to anybody that is already suffering with some kind of heart problem. You can add HeartLife into any pharmaceutical agent. It won't stop the way that drug works on your cardiovascular system. What it will do is help it. So you might be able to reduce blood pressure drugs, reduce cholesterol drugs. You can take blood thinners as well at the same time. And you may also need to have that dose adjusted because, again, the allicin and all those other ingredients work in synergy with each other and help to improve the clotting factors in your blood supply. So they're improving your red cells significantly. Now, people say, well, I don't like taking capsules. You don't have to. You can take the HeartLife capsules, you can break them open, and you can put them onto your favorite cereal or onto a piece of toast, or you can put them into a juice drink and take them down that way if you don't want to swallow capsules. So there are lots of different ways of getting benefit from a product like HeartLife. And I think it actually tastes great as well. If you take it in the evening, which is when I take mine, I find that it actually relaxes my body quite quickly, and I can get to sleep a little bit faster. We got a young baby, so sleep is crucial. And if you go to bed and you lie awake, you think she's going to wake up in 5 minutes. I know she is. But that's all psychological. If you can just relax yourself a little bit, you can get to sleep. And that's what heals the body, is good night's sleep. And HeartLife is very good at helping you to do that. So I'm going to stop there, Jasmine. I think that was slightly over your 10 minutes, but hopefully it was okay for you. Thank you. So open up, unmute, ladies and gentlemen. If you have any questions, just shout them out and we'll take it from there.
Thank you, Peter. Yeah, wow, I learned a lot. Yeah, that's great. I actually have used our HeartLife on our garden for a pesticide.
Really?
To get rid of aphids because of the cayenne, and
wow.
We mixed a capsule in with some Bronner's soap and water, and this was Lucas's idea as an organic farmer, and just sprayed it on and got rid of our pests in the garden.
What a clever idea. Wow, that's brilliant. Yeah. I like that.
Mm-hmm.
That's excellent. Wow. So we should talk about that in the future.
Yeah, definitely. I think I made a post about it on Facebook, but I think, Kate, did you have any questions you wanted to ask?
Well, yes. What would you recommend based on the fact that I'm taking Eliquis for blood thinner for the AFib?
Yep.
Now he's discovered the A flutter, and he said the flutter can be cured with one ablation that's simpler. The AFib could be helped with a different, deeper ablation. So that's on the docket to be coming in December. And I want to get through all of this. I have the high blood pressure, have taken medicine for years. I have the high cholesterol, have had it all my life. Stress, feel like I've got a lot of stress, so I work on breathing and meditation, but I'm having to work with stress. So I know those things are happening in my body.
Kate, you've never taken the HeartLife before?
HeartLife I haven't taken, but I've taken lots of your products before.
So the allergen.
It was heart fast. It was heart fast.
Oh yeah. Okay.
Allergen.
That's allergen.
Yep.
Okay, so with any product, it goes through a development phase, and then it gets to a phase where you need to reformulate a little bit. So HeartLife is the most up-to-date formulation, and that's basically more effective than any previous combinations that you might have seen or come across. I think from your point of view, there should be absolutely no reason why you can't take 2 capsules a day. I would start with that. And I personally, do you have any trouble sleeping or not?
No, I'm not really having a lot of trouble with that.
Okay,
It's
well,
just
in that
making
case,
myself go to bed.
yeah, in that case, you can take the HeartLife whenever you want, probably with your main meal actually is the best time for you to take it. So whenever you have your biggest food, take it then. And I think you'll find it should help you significantly. So maybe you could try it out and report back to us in, a few months' time.
Okay, so it's okay with the AFib.
Yep.
And the other thing, is there anything that I should do that involves your products after they do this? What's got me a little scared is the word ablation and burning, and
Yeah, I understand that. I mean, it's a pretty common technique, so I don't think you should worry much about that. It's gonna be fine. So these people are very experienced at this kind of thing. So if they feel you need it, then it's probably best to go with that and not worry about it, because at the end of the day, we all want to make you healthier and fitter and able to deal with daily life, a bit better. So if that's what's been recommended, I would always concur with your doctor, unless I knew something, completely different. But there's no reason why you can't add in a couple of capsules of HeartLife just to help that cardiovascular system become a little bit cleaner and to be able to pump a bit more blood around the cardiovascular system. That's going to be a good thing for you before an operation and indeed afterwards, definitely. Okay?
Okay, so there's not anything else that you are manufacturing that I should add in to boost the recovery from that?
I don't think so. I think once
Okay.
you're trying to recover, we've got lots of agents in there in the HeartLife that will help your system recover quickly. So if I were you, I would do that and just persevere. Okay.
And then
Thanks for the help.
my mom was listening in and saying perhaps the gel would help after a surgery.
Well, obviously, the gel is basically allicin and aloe vera, so it's very good at its most proper uses for preventing infection, and anything topical that's infected, then the gel is incredibly good at getting rid of those topical infections. The best thing you can do is put it up each nostril as well. Certainly, if you're going into hospital, I would certainly do that 2 or 3 days before. As soon as you've had the operation, if you can, I would put a little bit more up each nostril as well, just to keep you free from any infections, because obviously that's something that's a possibility in the hospital. Although I have to tell you, in the UK, there are no other operations happening at all, because everyone's panicking about the vaccination. So they're going to give everybody a booster dose, apparently, and they expect to give everyone a booster dose by the end of January. That's 60 million people. So I don't think anybody's going to get admitted into a hospital for any other reason whatsoever. I think it's pure nuts, but there you go. Don't want to get too Jeff Rent's political, Jessamine.
Well, good. It sounds like you are set, Kate. I'm glad you came on the call.
Well, and I used the gel in my nose before I went to the Thanksgiving gathering. I mean, I am dyed-in-the-wool user of Peter Josling's products for like it's like 15 or 20 years. There's nothing like them. Nothing. So thank you for everything.
Yeah, well, thank you. Thank you very much for your support over those years. I appreciate it. We're only trying to do good for people, and it's always nice to hear somebody who's been on the products for a long, long time and thinks that they are really helping. So thank you very much.
Yeah, thanks. And Kate, how did you hear about this? Were you through Janet Smith, or are you on our mail list?
Yeah, she's one of Jan's.
Okay. Well, if you want to be on our mailing list,
Well,
anybody who's not, please feel free to put your email direct chat to me, or and then you could make sure that you know when Peter is sharing once a month.
thank you.
Mary, did you want to speak?
Mary, hi.
Hi. So I have a question. So I was introduced, of course, to the LAC many years ago, and we've been using it for, I don't know, how long has it been out?
Oh, years and years.
A long time.
Amy and I would not like to divulge that. Really.
Okay. but I'm being educated through this website about all the other products, which I really didn't know about. So if I have people that are taking LAC for their immune system or whatever, you know, they bump it up when they feel like they're getting something. If they take the heart product, does that have enough of the garlic in it that they could just take that, or do they need to add one of the other garlic products? Or
Okay, so the LAC has twice as much allicin in it, but it doesn't have the other ingredients. It has vitamin C, obviously. So it's horses for courses. So the HeartLife is really designed for people who are worried about their heart and circulatory system. It's designed for people who already have heart disease or a history of heart disease, whereas the LAC is really meant for preventing infection.
okay.
So anyone that's worried about coughs, colds, viruses, flu, bacterial infections, MRSA, MRSA, this kind of thing, then those people are going to be better off on the LAC. And then if those people age and start developing heart disease, then we would probably say add in the HeartLife, so you take both products at the same time. Okay.
So when you become a certain age or have a certain symptoms, you don't automatically start with the heart product. You could still stay with your LAC or what's the allergen as well?
LAC and allergen are very similar in many respects. The allergen is really meant to be for people with arthritis. However, I have to tell you, it's never really ever been used in any great degree for arthritis, even though the ginger is there deliberately to improve joint mobility. You know, it's my formulations are for specific reasons. And so the allergen is for joint pain, but it's a very good anti-infective because it's got plenty of allicin in it. The LAC is the best product for preventing bugs, infection, microbes, viruses, parasites, that kind of thing, okay? Where your bloodstream is infected, where you're worried about certain viruses, shall we say. Whereas the HeartLife is really specifically for people who worry about their heart. And that's an enormous number of people. Like I said to you at the very beginning, you lose 360,000 people every year to heart disease. Okay, this year is a bit different, and you've lost a hell of a lot of people to COVID-19. But that heart disease level is still there. There are still, you know, one heart attack one person dies in the US every 33 seconds because of heart disease. So there are a lot of people out there that know absolutely nothing about HeartLife, and yet if they were on it, they would be living longer. So that's the group that we're trying to target with HeartLife, is people who worry about their heart condition, if they have one, or people who have a family history of heart disease, or people who are just so stressed that they are raising their blood pressure, raising their cholesterol, and those are the two major risk factors for developing heart disease. As you know, cholesterol is furring up of the arteries. That happens over a number of years due to a poor diet, lack of exercise, all these kinds of things, smoking, too much alcohol, all this kind of stuff. And so it's very easy to compartmentalize people when you listen to them and when you talk to them. And it's quite important for someone like you, Mary, to talk to these people and find out what really is going on in here. What are they really worried about? And it may be that it's their heart. If it is, HeartLife first. first, straight away. If it's, oh, I'm worried about COVID or bugs or flu or cold, or I've got a family full of children, they're always getting sick, Ali C. First choice, definitely. Okay?
If people are on the heart product and they want to add more protection, they could just add an LEC to it.
They could do, yes. There'd be no harm in doing that whatsoever. If that's what they would like to do, that's absolutely fine by me, because you're going to get a lot more allicin in your bloodstream. And that means the chances are that viruses and bacteria are far less likely to invade and to replicate. Now, we've just finished some work on COVID-19 and on coronavirus 229E, and we've shown that the allicin can actually capture the virus and prevent it from replicating. So it obviously is very good at capturing microbes and helping your body to just destroy them naturally. Okay?
That is awesome. I have one other quick question about, about the gel. It does say, I mean, I carry it in my pocket. I travel a lot. So anyway, it says it's best if it's refrigerated, but I hardly ever have a chance to put it in the refrigerator.
Yeah, no, it's not absolutely necessary whatsoever. The only thing you should do is avoid direct sunlight and very hot temperatures. So, I mean, that's an obvious thing to be able to avoid. So apart from that, honestly, I've had gel in my house for 4, 5, 6 years, and I still use it. And I never keep it in the fridge. Never.
Okay, perfect. I'm giving it for Christmas presents. So.
Oh, wow. Well, I think that's a good Christmas present, to be honest.
Stocking stuffer, stocking stuffer.
Yes, exactly. Used to be an orange in my day. Anybody else with any questions? Renee, do you have a question at all? Are you okay?
It looks
Everything
like
all right? You have to unmute.
You're muted, Renee, and it looks like after Renee, Daniel has a question.
Oh, okay.
Yeah, I'm sorry that I was late. I was on the phone with good old IRS, so you don't, you know, fool with them. You got to stay on until they're done. So anyway,
yes.
But actually, Peter, right now I'm going to be. I've not done that stool test to double check about the H. pylori.
Oh yeah.
Because I was trying to take a lot of the allergen and get myself all, you know, inundated with that. So hopefully it'll be a good outcome. So by next call, hopefully I'll have some information for you. Great.
That's good.
The only thing I noticed when you were speaking to Mary, you were saying about Ali-C versus allergen. It almost sounded like the Ali-C might have been better for me versus the allergen. But of course,
well, at the end of the day, it's not the other ingredients, the C or the ginger, that is going to kill the H. pylori. It's the allicin. Okay, so our tests show that the allicin can kill H. pylori very easily. You know, so I don't think it makes any difference from what is your problem as to which one you take. So I think you should persevere with the allergen and take the dose that I recommended, and let us know what the result is when you get the chance to have yourself tested again, okay?
Absolutely, will do.
Great, thanks, Renee. And now, Daniel.
Hi, good evening, Peter.
Hi, Daniel, how are you?
Well, got very grateful. The question that I have, I've been on the Ali-C for, gosh, way back to 05, I think. I met Amy. So,
wow, thank you.
Yeah. Now, you've changed up you said this is the newest formulation, the HeartLife.
That's
and
right.
So,
yep.
Yeah.
But so is the Ali-C as well. The Ali-C is also a formulation of stabilized allicin, and obviously I don't stand still. So we've worked on making that allicin more effective. So, you know, you may notice some changes in the powder, the color, or the consistency, and that's perfectly natural and normal. We have a specification that we adhere to, and we guarantee that every capsule of Ali-C will kill methicillin-resistant Staphylococcus aureus, or MRSA bacteria. So every batch that we make is routinely assayed against MRSA, as well as lots of other things as well. And my guarantee is that if you take it every day, you will never get a MRSA infection.
Okay. I recently had a surgery, so I got like 2 questions. I'll make it as fast as I can.
Don't worry, we got all night. Don't worry.
No. You need your rest, sir. I know what time it is over there.
Oh, come on. I'm not going to bed at 8:30. No way.
Okay.
Besides, baby's not asleep yet, so don't worry. Anyway, come on. Let's get the first question.
Okay, first one. I was overseas in Europe and I had to have a procedure. And as soon as I got out of the procedure, I started right away on my Ali-C. And now I've got an Ali gel, and I've had it in my refrigerator for years. And it's always been refrigerated. And I was thinking, you were talking about using it topically for surgery sites. So my question, it still should be fine years later to use on a surgery site, right?
Definitely. Can I just ask one question?
Yeah.
What kind of color is it?
It's still the same
Sort
same
of a
color.
mildy yellowy color, yeah?
Yeah.
Right. In that case, I would say it's perfectly okay. I can't see any reason why you can't use it topically on any kind of surgical closure. It will help the wound heal completely underneath, and also it will probably reduce the scarring from any kind of surgical wound as well. Doesn't matter how big or small that wound is, just cover it with the gel. 2 or 3 times a day is fine if you can manage that, and I think you'll notice that it'll improve very dramatically.
Okay. The doctor that I saw for follow-up yesterday said, go get some Vaseline. And then when I came to this call, I was like, light bulb, Ali gel.
Yeah. Well, Vaseline is okay, but what's it going to do? Nothing.
Right. So,
Really?
so my other question, I got a testimony. Back when I started on Ali-C, I didn't have all the best diet in the world. I was still eating animal foods and all that stuff. And I slowly got off of that. I'm all plant-based. And the Ali-C dropped my cholesterol drastically. But I do have a small leakage in one of my heart valves. It's not serious, but it's a minor thing.
Okay.
So I'm thinking that the best thing for me is to be on that HeartLife, just to be on the preventive side there. So
well, I think you could probably add in, like we said earlier, 2 capsules a day. I wouldn't stop taking the Ali-C because you've been on that for such a long time, and it's obviously keeping your immune system pretty fit and healthy. But if you want to add in a couple of HeartLife, then that's good, because at the end of the day, like we said, your heart just wants the best blood supply it can be given. And that means making sure that those red cells are as fit and healthy as possible. Now, obviously, you know that every 2 or 3 months, the whole of your red blood cells get replaced anyway. So there's absolutely no reason why you shouldn't take HeartLife for the next 2 or 3 months, just to try and help that leakage and make sure that that the blood that hits those vessels is of the best quality that it can be. Okay.
all right, thank you.
Peter,
welcome.
I have a couple of questions.
Yep.
So I think on the HeartLife bottle, it says to not take over a certain amount. Is that correct?
6 per day is the maximum daily dose. no one should need more than 6 per day because it's a very, very efficient compound. If you were silly enough to take a number of capsules outside my recommendation, it won't do you any harm, but you really don't need to take any more than 6. We've shown drops in artery age of more than 20 years from people taking 6 a day. You know, you can have an interior age of, let's say you're 50, we measure your internal artery age and you come out at 65. That's really bad. But if you take up to 6 HeartLife in every day, we can get that 65 down to 50. So it's you just don't need more than 6 a day.
Okay, that's good to know. And then, is it counter-indicated to take HeartLife because of the L-arginine if someone has herpes?
No, it's only a very small amount of arginine.
Okay.
It's not going to do any damage to anybody if you carry the herpes virus. In fact, it's probably going to help to get rid of the herpes virus.
Good. Okay, great.
Good. Any more for any more? Okay, so do you want to wrap it up, Jessamine, or?
Sure thing. And stay on after if you would like a coupon for $10 off your next purchase for HeartLife. And yes, thank you so much, Peter. Our next call will be January 6th at 5:30 p.m. Is that an okay?
In that case, happy Christmas, everybody.
Happy Christmas.
Happy New Year.
Same to you
I
all.
hope you all have a wonderful Christmas and you get some stress-free time over the holiday period.
You too.